Do you frequently feel like your heart pains sometimes? Or maybe your joints hurt out of nowhere, even when you haven't done any exercise? What if I told you your body might be fighting something, not just a virus, but a harmless medicine or shot? That's what can happen in a condition called serum sickness. It's like your immune system gets confused and attacks your own body by mistake. It doesn't happen to everyone, but when it does, it feels like a strange mix of allergy and illness. Have you or someone you know ever felt sick a week after a shot or medicine? It might have been something like serum sickness. So what causes serum sickness? It's mostly triggered when your body reacts to foreign proteins, especially those found in certain medicines or anti-serum. Think of anti-serum like a rescue package from animals. For example, if you get bitten by a dangerous snake, doctors might give you antivenom made from horse or rabbit blood. That helps fight the poison, right? But sometimes, your immune system sees those animal proteins as invaders. A week or two later, it starts attacking them, and your own tissues get caught in the crossfire. Common causes include antivenom, certain antibiotics like penicillin, and even some vaccines or biologic drugs used for autoimmune diseases. Ever taken a medicine and felt worse after 5 to 10 days? Not right away, but later. That delay is a big clue. Now, what does serum sickness actually feel like? Imagine this: a few days after a shot or medicine, you start feeling flu-like. You get a fever, your joints swell and hurt, especially fingers, knees, or ankles, and you notice a strange rash, often on your arms and legs, kind of like hives or red patches. Some people say it feels like they are getting sick all over again. You might also feel tired, have swollen lymph nodes, or even pain in your belly. In rare cases, the kidneys can be affected, like your body's filter gets clogged. Do you know someone who had a shot and then broke out in a weird rash a week later? That is not just bad luck, it could be serum sickness yelling for attention. How do doctors know it's serum sickness and not just a cold or allergy? First, they will ask, when did you start feeling sick? What medicine did you take? The timing is important. Symptoms usually show up 1 to 2 weeks after exposure. They might take blood tests to check for immune complexes. Those are clumps of antibodies stuck to foreign proteins, or look for signs of inflammation. Sometimes, a skin biopsy, a tiny skin sample, helps confirm it. Treatment: stop the cause, like stopping the medicine. Then use anti-inflammatory drugs, such as ibuprofen for pain, antihistamines for rash, or in serious cases, steroids like prednisone to calm the immune system. Think of it like turning down the volume on a shouting immune system. Once the trigger is gone, most people feel better in 1 to 2 weeks. Can we prevent serum sickness? Yes, by being aware. If you know you reacted badly to animal-based serum or certain drugs before, tell your doctor. They might choose a different treatment or monitor you closely. For example, if you need antivenom, some clinics use purified versions with fewer animal proteins. Doctors also try to avoid long-term use of suspect drugs when possible. Do you keep a personal health diary? Writing down bad reactions helps you and your doctor make safer choices. Prevention is like wearing a helmet. You hope you won't need it, but it's smart to have just in case. Now the cool part: science is moving fast. Recent research is working on making anti-serum safer. Scientists are using genetic engineering to humanize animal antibodies, meaning they tweak animal proteins to look more like human ones, so your immune system won't attack them. There's also better testing to predict who might react badly. Some studies use artificial intelligence to analyze patient data and spot early patterns of serum sickness. Imagine your doctor getting an alert on their tablet: warning, high risk of serum sickness with this drug. That future is closer than you think. Research doesn't just help the sick, it protects everyone using life-saving serums.